Ruby, turn the computer screen off, whoever's running the technical part of this. I would appreciate that.
All right, let's set the ground rules once again. My name is Maurice, and we'll be polite as much as possible, but when we set the ground rules, the senator's already stated them, but let's just reiterate them just so we have a clear understanding. Everybody here is welcome to ask your question. If you have a question, please write it down. Somebody will come by and pick that question up. We have gone through some of the questions so that we don't repeat ourselves over and over again. So we want to make sure we get an opportunity to answer as many questions as possible. So if some questions are repetitive, we'll kind of pick out one that's going to answer or has the same concern that everybody else has. So everyone will get a chance to ask their question. Please, when you are approached, please do not grab the mic. They will hold the mic for you. When you ask your question, please be precise. Don't repeat yourself if you can. And let's be mindful and respectful of everyone here. So let's begin tonight with, I believe, Wayne. Wayne Hardwick has a question that he wants to talk about or ask about defensive medicine. Wayne, are you here?
Yeah.
You just raise your hand. They'll come right to you.
Wayne's right here.
Hold on just a minute, Wayne. That might come right down to you.
Oh, wait, everybody can hear me.
Physicians order expensive tests because they're well aware of physicians that didn't order those tests and got sued. Any comments on that? And do you see any kind of protection against sanctions against physicians that do order expensive tests when they can show that in similar circumstances those physicians that didn't order those tests got sued?
You know, defensive medicine, we know, adds a lot of costs. And we know that most physicians, if you just talk to them practical experience, they order a lot of unnecessary tests on the if chance that if they're in front of a jury, they better have ordered every possible test you could possibly imagine. And that's one of the reasons that I've said that we need medical liability reform. And part of the adoption of medical liability reform needs to be the standards of practice. If you're following the standards of practice, you know, then just because you didn't run a particular test, if that wasn't included in the standard of practice, you shouldn't be able to be sued in that case. You know, that's my opinion. The problem is today, and I mean the trial lawyers, you know, they are the most powerful lobby, if at least one of the top 2 or 3 powerful lobbies in the United States. And they put a lot of money in campaigns across them, and you know, they're just really powerful. And that's why, that's one reason I'm very excited about what's happening in America right now, is the voice of the people are finally rising up. And I've been in office now since, on and off a little bit, since 1994, when I was first elected. This is the most passionate, even including 1994, that I've ever seen the American people. And it's not just on healthcare, it's on a lot of issues. People are finally starting to wake up, and I hope that that passion turns into action by people, writing, emails, showing up to things like this, just really, you know, getting involved as much as possible.
All right, thank you, Wayne. Next question is from Kathleen Ingen. I hope I'm pronouncing your name right. She wants to know about the impact on seniors, hurting families, and why insurance companies are practicing defensive medicine.
Kathleen, raise your hand.
Kathleen, are you here?
Thank you. Down here. Run, run, run.
Follow the rules. Well, looking at different articles on this bill, you know, there's pros and cons. And with my family, the AARP and also the Alliance for Retired People, they came out strongly supporting this bill, saying, especially when my family was concerned with closing the donut hole for Medicare Part D, for those type of things. So I'm just wondering how you are so strongly against it.
Sure.
With some positives that,
Right.
that actually happened. And also that there were going to be reduced premiums for Nevada. I don't care which side, Republican or Democrat, I'm
Right.
concerned with reduced premiums and our families getting help.
Well, first of all, on the reduced premiums, most people's premiums will continue to go up at the rate they're going up now, except for if you're an individual or families buying on the individual market, your rates will go up faster. Now, to be fair, that happens so that some people who are uninsured get paid for it. But people just have to know going in, they were promised that the premiums would go down about $2,500 a year. That doesn't happen under this bill. And those aren't my numbers. Those are objective Congressional Budget Office, nonpartisan Congressional Budget Office numbers. So that's the answer to that. That it really is that's why I said this bill does not address cost, and it should have. That's the number one problem we have is medical inflation is too high. Too many people are becoming uninsured because it's just becoming way too expensive. Now, to explain for those who don't understand the donut hole, if you're on Medicare, the Medicare prescription drug bill that was passed several years ago covered drugs up to a certain amount of money, and then there was a couple $1,000s, I forget the exact number, depends on your income level. There's a donut hole where you actually have to then pay out of pocket, and then the government picks up the tab after that. Some people want to close that donut hole so that people don't have that out-of-pocket expense. Well, that does cost money. Somebody has to pay for that. In Medicare Advantage, there is no donut hole. Okay? For most plans, there's no donut hole. The vast majority of plans don't have it. You can actually find plans out there in Medicare Advantage that there is no donut hole because the private sector figured out a way to close that donut hole without costing the taxpayers more money. So, one of the ways that they're closing that donut hole is taking money out of Medicare Advantage, which a lot of seniors actually like, and putting it in to close the donut hole. But if they don't like the donut hole, there's options out there right now that they can close it on their own just by choosing Medicare Advantage. Okay, next question.
Next question is from Valerie Clark. She's concerned about the deal.
Valerie, raise your hand.
Valerie, she's concerned about the deal that was made with Senator Nelson.
Okay.
And constitutionality.
Sorry, you were getting it. Yeah, I was just really concerned because the deal that was cut by Senator Nelson on the expansion of Medicaid and funding by the federal government seems to exclude the majority of states. I believe it's 47 states. And is that constitutional, number one? Number two, can it go through actually, and will it ever be challenged? Because the rest of us are going to be picking up the tab for that when we can't even afford it for our own citizens.
Right. The deal that she's talking about, Senator Nelson got a special deal for Nebraska on Medicaid. Medicaid's expanded in this bill. By the way, Medicaid, do we have any doctors in the room? How well does Medicaid reimburse right now? It's really bad, right? Do you want to see Medicaid expanded where more people are actually paying such really poor rates? About half the doctors in America today don't take new Medicaid patients. And this bill is dramatically expanding Medicaid roles, but it also puts a huge unfunded mandate on most states except Nebraska. Okay, Nebraska got a special deal. That's not what we're supposed to be doing. Somebody asked me if I would support a special deal like that from Nevada. I said absolutely not. You know why? Because I don't believe in putting states against states. I think that what we should do is look for a health care bill that's good for all of America. That'll be good for Nevada. Don't buy my vote by trying to pay for Nevada's Medicaid at the expense of other states. I think it is absolutely wrong, and what I loved is their governor came out and said, we don't want this deal. And the people of Nebraska, they pulled them out, and they were embarrassed by the deal. So I don't know. It's caught so much heat, they may actually pull that out of the bill. But it wasn't the only part. Remember something called the Louisiana Purchase? Okay, and she actually went to the floor of the U.S. Senate and bragged because they said it was $100 million, and she said it was not. It was $300 million. So, and she bragged about it, that's how they got her vote, because she was saying she was voting against it until she got the $300 million for her state. I just think that kind of stuff is wrong, and there are about 3 or 4 other things that, that are in there. I believe there's several parts of this bill that are unconstitutional. I raised the constitutionality question on the individual mandate, raised the constitutional point of order, that was defeated, but I think that, I know that's going to be challenged. I hope the Supreme Court sees it the way that I saw it, and the way that a bunch of us saw it, because I do believe the federal government has never, in the history of the United States, said to an individual that just because you're a citizen, you're not doing anything, you just exist as an American, that you must do something or you can face a fine. Never in the history of the United States. And it's absolutely, I believe, against the enumerated powers of the United States Constitution, and that's why I raised it.